Hi, everyone. I'm Sandra Jarrett, Chair of the Education Committee. I want to thank you for taking time to join us today for our Lunch and Learn webinar hosted by the North Carolina Medical Group Management Association and the North Carolina Medical Society Foundation. We're thrilled to have you with us. North Carolina Medical Group Manager Association's mission is to maximize the value and effectiveness of medical practice leaders through educational programs, information exchange, networking, and professional development opportunities. NCMS's mission is to provide leadership in medicine by uniting, serving, and representing physicians and their healthcare teams to enhance the health of North Carolinians. We have enjoyed our collaboration with these Lunch and Learn webinars we produce for our membership and in each of our shared educational opportunities. We embody these two missions, and this virtual meeting is no exception. Today's presentation is focused on customer service, and I know I'm speaking for almost all of us, if not everyone, that this is something we're all wanting to better our practices with. Today's presentation, Medical Practice Customer Service Strategies, How to Make Almost Everyone Happy, is presented by our friends at Raider 8. Throughout the presentation, you can submit questions in the chat, either directly to me or to everyone. We plan to have some time at the end of the presentation to answer all your questions. Again, please send your questions throughout the presentation and we'll address them at the end. We will be recording this presentation, which will be made available to you after today's session. Without further ado, I'd like to introduce our speakers today. We have Ron Horchesky. He is the Chief Executive Officer of Midlands Orthopedics and Neurosurgery. We have Bradley Shield. He is an experienced healthcare leader. Melissa Kale, Practice Administrator for Catawba Pediatric Association. And our moderator is Marc Kleinman, Vice President of Sales with Raider 8.
Thank you, Sandra. Sorry, I was just unmuting myself there. And thank you everyone for joining us. I think this should be a really fun and valuable discussion for everyone. We've selected our three panelists here because they are each real standouts as it relates to customer service in their practices and patient satisfaction and experience as measured through our surveys. So we know these are top performers that have a lot of valuable insights to share. We are going to do less of a presentation today. In fact, if we could stop the screen sharing, Melissa, that would probably be helpful. And more of a free-form panel discussion. I will provide some questions as prompts to let the three of these experts weigh in on their experiences creating a culture of customer service in each of their practices. I have planned out some very specific topics. I hope we're able to get to them all. Things like how staff and staffing issues impact the customer experience, technology, use of data, all sorts of things. But would love to start at kind of the highest, broadest level and just open it up to the three of you to talk about what you view as some of the key drivers in your practices of customer service and of patient satisfaction specifically. So what things come to mind when you think about what makes a patient happy or unhappy as they walk out your doors? And we'll start there, and I'll turn it over to any of the three of you that wants to get us started. Or I'll nominate someone.
I would say go ahead, Ron.
Oh, no, you go ahead, Melissa. Get us started.
I would say in our practice, it's trust in physicians, the friendliness of staff. We're pediatrics, and so naturally those interactions with our patients and their parents make a big difference for our patients. So our waiting room time is also something that we monitor. And of course, our waiting rooms have been closed down for a while, and we're just now getting back to that. But those are some of the key factors that we have noticed through evaluating our data and really getting into what our patients are looking for through the responses that we're getting via Rater 8.
I can jump in too, Mark. I think that one of the key strategies that I've tried to employ through my career with customer service is to try to build a common language among the staff so that when something happens, we can all speak a language that we all understand. As an example, Disney has this outlook of something being on stage versus off stage. So those are two terms that we use a fair amount to say, hey, let's take this off stage, or to think about what the patient is actually seeing when they're in the office. And then another piece that I'll just add one more piece, which is that sometimes you can refer to, we talk about customer satisfaction and this patient satisfaction. I think sometimes it's great to understand that in an organization that we are each other's customers as well. So it's beyond patient satisfaction. It's very, of course, patient satisfaction is very important, but physicians also have to understand that, it's not just the patient they're trying to satisfy. They need, because of the challenges of just recruitment, that you want to recognize that your medical assistant is a customer, that the people that are checking in, patients are customers as well. So customer satisfaction goes beyond patients in and of themselves.
It's interesting.
Brad, you are on mute, just so you know.
Thanks, Ron.
Good start. So I would add to that I would say always we tend to focus because we have so many touch points within a practice that the patient can touch one of our people. So the phone, check in, check out, the MA, they can interact with the physician, interact with checkout, interact with billing. So when people ask me about the patient experience, I always say it's the entire thing, right? And that's one of the things that we've really learned through studying the statistics, is that anywhere in the chain can blow it for you in terms of the patient experience. So to always remember that the experience is the entire thing. So you need the entire crew kind of committed to this philosophy and engaged in this philosophy, because any one person can really upset a patient in the wrong way and blow the experience of your practice. And to kind of add to that with what Ron was saying, that I really found that culture internally is really important from a, what you would basically call a happiness perspective, right? If you don't have a good culture and you've got a lot of things going wrong and your employees are unhappy, it is very difficult to ever get them to deliver the kind of experience that you're hoping you would have if you walk through the door. So it's remembering that the entire experience counts, and then also trying to do something to make your employees feel the same way, because if they don't, they're not going to be very good at actually delivering a high level experience.
Yeah, those are all interesting responses, and the thread that I see tying them together is the element of staff. And in one form or fashion, you all alluded to multiple touch points and the culture of the staff, and Ron was talking about the staff in some cases being like a customer. So I want to dig in there a little bit. How do you create a set of standards for your team, and then how do you hold your staff members accountable to those standards? Like, what methods, rewards, punishments, measurement, whatever it is, what methods do you have in place to be able to really hold staff accountable to that culture of customer service?
I can jump in, Mark. I think that this is a really critical question, because you want to create a culture where somebody who's dealing with an upset patient in front of them doesn't have to feel the eyes of everybody else staring at them. If they feel like, oh, I'm going to get in trouble because I've got a patient who's upset in front of me, that's a distraction from actually solving the problem. So if you're able to create a culture where the staff knows, like, hey, I've been empowered in these situations to, maybe I'll bend a rule for this patient, and I'm not going to get in trouble for it because I'm going the extra mile for the patient. It really depends upon on the rule that's being bent. But I really feel, and I think every single person on this webinar right now knows the experience of somebody who's working towards yes or somebody who's working towards no, right? When you walk, and this is a terrible example because I hate to group the Department of Motor Vehicles into one subset, but I've had the experience of walking in the DMV where I feel like sometimes they're trying to say no, like they're trying to find an excuse for me not to get what I need. And patients see that in our staff too. It's like, are they like I walked in from the street without an appointment. Are they trying to get me in? You know, maybe that's an unreasonable expectation, but if they see, hey, I'm doing everything I can to get you in, but every one of our providers is booked up. We have a lot of patients sitting in the waiting room. So, you know, just the way that they address that, that issue of either working towards saying no or working towards saying yes, and then having a non-blaming culture where somebody can take a chance, and maybe it's a belly flop, right? And they're not going to get in trouble for it. So that would be my input.
Ron, is the kind of rule of thumb in your practices to have people working toward the yes? Is that kind of the high level training? Obviously, depending on the scenario, but that's the goal.
That's my personal ultimate goal. And I'm fairly new at the practice that I'm in right now, so this is well timed for me because there's a lot of messaging that I need to incorporate with my own staff in terms of just empowering them with information to do just that.
Yeah, so I would say also, so clarity is a big deal, right? And I think it's one of the areas sometimes as leadership we fail on clarity for our teams, right? So when people ask me about this idea of customer service and what we're shooting for, I always try and start with the highest level that I can think of for them and to simplify the conceptual framework for them. And so I always say to everybody, we want to be world-class, right? And everybody always asks me, what do you mean by world-class? I mean, you want to compare yourself to the best of customer service that there is. So you're not, you know, your bar is extremely high for how you do this. And so they asked me again, well, Brad, what does that mean? You say world-class. I said, well, for me, it's very simple in healthcare. What is the experience you want to have from end to end to end when you come into a medical practice, right? What do you want it to sound like when you're trying to make an appointment? What do you want it to sound like when you walk through the door and somebody greets you at check-in? How do you want the MA or the nurse to treat you when you're in the exam room? What kind of experience do you want with a physician? So I start with that conceptual framework for them to kind of understand what we're shooting for in the long run. We're shooting for fantastic customer service. But your question is a good question about how you build that into the culture. And what I've learned is that you've got to integrate that also, for example, with the job descriptions or the performance management, right? If you really want accountability, you have to actually turn it into some sort of measurable concept for them, right? Something where they are actually being communicated to talk about how well they're doing, right? And so conceptually, we talk about it, but then we build it into the performance management, which is before you ever measure how your employee's doing, is how we communicated clearly the expectation and clearly what we consider to be good customer service, whether it's the front or the back or however you want to do it. So the question is, when you get to the idea that you're going to review this employee, have you given them some guidelines that you can actually turn into a part of their review process that says, hey, you're ticking these things off excellent, or you're not ticking these things off in the way that I would want you to tick off in terms of customer service. So building customer service into the review platform, and this goes to, you know, when they ask for bonuses, they ask for raises, because everybody always expects these things and they say, hey, I'm doing a fantastic job. Where we don't do a good job as leadership is to turn that into something actionable or reviewable for the employee to understand what our expectation looks like and how they're doing in the process, and then connect the dots all the way through how we compensate them or what we do. And the last piece I would tell you with Raterade as an example of things that I learned is kudos and also negatives, right? What I love about Raterade is it adds a little bonus. As an example, when you have good patient surveys, it adds a bonus because it's favoritism can go out the door when you talk about these concepts from management down to employees. oh, this one prefers this one, or this prefers that one. What I love about adding to the concept of having a really solid review process is if you have call outs, either negative or positive from some solid patient reviews, I like to add that to the file for the employee always, whether it's negative or positive, so that you have that added conversation, not only hopefully you're doing it on a regular basis, but also within the review process to say this person, wow, why do we call them an A player? Because this quarter they had, or this year they had 17 call outs or 5 call outs. That shows you how great of a job that they're doing. So I love that as part of the process.
And do you find, Brad, that it's more powerful if you're tying that directly to their incentives or compensation or like meaningful, tangible things, or is it more about the kind of pat on the back, kudos to reward those call outs?
So employee morale, they want to hear it. So I always say it. So employee morale, they have to hear it. If you never tell your employees anything positive, and then you come at them with the negatives, they're just lost in terms of the positive nature of wanting to do a good job for you, right? And so kudos, yes, but definitely tying it to the performance, because clarity is one of the things we don't do great for employees when we're talking about why do I deserve a raise or not deserve a raise, right? And so I can tell you that if you go to most people up front, they will think they're doing, for example, a good job of customer service. But we all know that it's probably not true, right? That there's some that are amazing at it, some are good at it, and some are actually pretty bad. You walk up and they're staring down, they don't smile, there's no greeting. So communicating that in a very specific way is important if you want improvements in the way that they do customer service for you.
And it sounds like, if I'm interpreting correctly, it's both through your own observations of the employee's behavior, but also through the direct feedback that you're getting from patients through things like surveys. By the way, I should mention for the audience, we are not here to promote Rate, I promise, but you've already heard Brad refer to it. So for those that don't know, Rate provides all 3 of these practices here with reputation management in the form of patient satisfaction surveys that they'll probably refer to a few times, but also with online reviews management. So I just wanted to clarify who we are in this mix, but I promise we're not here to promote ourselves. And with that said, Melissa, I imagine you probably want to weigh into on this issue of holding staff accountable to customer service standards.
We do. I think it's more important today than ever before. And the way we compliment our staff and let them know the things that they are doing well. We are all so busy and many times understaffed and overwhelmed in our day-to-day that we need to hear the good, positive things. And this gives us a mechanism to be able to do that. Previously, our surveys were, we did not have good response on, and so we didn't have the opportunity to share these wonderful comments with our staff, but we do so, and we reward them with thank you notes and gift cards and recognition in our staff meetings. We also incorporate that as part of our annual surveys. They have a section for accomplishments as well as goals going forward. So I really like being able to incorporate those things, positive or negative, in those reviews. It helps give us something substantial to go on as well.
And I'm sure helpful from a retention standpoint, which is top of mind for all of us right now, I think nationwide. I noticed something conspicuously missing from each of your responses, which was the physicians in this mix and how to hold, how to foster this same culture of customer service and accountability among your actual providers. So can you each speak to like how you get them to buy into this as being an important thing, and similarly how you hold the physicians accountable to the same set of standards, not just the administrative staff or the mid-level providers? I know it's a touchy subject sometimes.
It's an important subject. I think that when you hear a complaint about a physician, the physician needs to understand that for there to be one written complaint, there's been 20 other people probably who have had the exact same experience. So it puts sometimes the administrator in an awkward position, but sometimes I feel like having the objective data that I personally get from Raider 8, or you get it from somebody else, that you can put that data in front of the physician and just say, hey, you're doing well with your reviews, but you're the bottom ranked physician in the practice, so let's talk about what you can do, and just relay the feedback. And I kind of go back on what Brad said about, with your staff, not just giving bad feedback. Every time I get a testimonial alert from Raider 8, I send that testimonial alert to the physician, even though they have the capacity to see it on their own. I will send them that testimonial alert so that they're getting a lot of good news from me too. So when they get the bad news, that it's there. But I think you have to hold firm, because I know my bottom ranked physician in my practice has met with me individually to say, hey, I want to handle things differently than everybody else because my reviews are low. It's like, no, you need to look within yourself to make some changes to improve your patient experience. It's not my fault or anybody else's fault.
That's interesting, because what I hear in that, I've heard many times before, working with lots of the practices that we work with, which is that self-assessment seems to be the key with physicians, with providers in general, giving them the opportunity to not just hear you say, this is what you're doing wrong, but to see that in the feedback and in the data and to draw those conclusions for themselves. Sounds to me like it's a more effective and consistent way to get folks to change their behaviors. Brad or Melissa, do you want to weigh in on the same topic?
Yeah, so it's up. Yeah, Melissa, you want to go first?
No, go ahead.
Yeah, I would just say that I hate to say this, but here's a little secret that I use. Is I like the competitive nature of the reviews, right? So most difficult conversations or a bad review is kind of handled one-on-one. You go to the physician, you share the review with them, you maybe talk to them about it. But one of the things that we, like to do is as we're doing what I call the build, which is you're first collecting the data, the patient reviews to see how you're doing. And then you're trying to take action on it, right? So you're in the process of trying to figure out how to do this better, get our ratings up, all these great things. And in general, I share that process with the physicians in, like typical physician meetings or whatever, to say, here's where we started, here are the gains we're making, here's the kind of things we're hearing as a group, where we're doing well, where we're doing bad. But I also tend to throw the rankings up. And the reason for that is doctors, by and large, by nature, are competitive people. And so if Dr. So-and-so has a 4.9, I mean, I've had doctors have 5.0 straight ratings, which is absolutely nuts. And you're a 4.6, I think there's definitely an incentive, right, to think about why are you a 4.6 versus someone else, and without necessarily having a long conversation in the boardroom necessarily. But I actually like the competitive nature of them knowing where we stand.
Right. And we get the monthly scorecards and share those with our physicians so they can see where they stand within our practice, what the benchmarking and trending looks like. And like you say, they are competitive to some degree. And there was a time they really didn't like when I brought up reviews and ratings in our physician meetings, because it was very negative. That's the only time people would go to online and make a review, was when something bad happened or negative in their eyes. And now we get lots of wonderful reviews that are there for them to see. And occasionally we'll get a negative review, and we sit there and work through and try to address how to improve that situation going forward. Naturally, at that point, I've already reached out to the parent and discussed the scenario and know what the situation was, and then we discuss how we maybe could handle that differently going forward. And usually we do that in a group setting, because what happens to one physician probably is happening to someone else, and we can all gain some value from that.
Yeah, Melissa, you said a couple of very interesting things that I'd love to latch onto. One in the form of a statement and the next in the form of a question. So absolutely what you said is true about the most motivated patients to go out and share their opinions are the ones who have had a negative experience. And as a result, it's very easy for us to all look at things like online reviews and say, oh my God, we're delivering terrible customer service. The statement here is that we have found at Rate that the overwhelming majority of patients across the board are highly satisfied. In fact, the number is 97% of the online reviews that we see come through our platform are 4- or 5-star reviews. So by and large, patients are very happy, and it's the ones who have had a negative experience that are most motivated to share their opinion, which leads to the question, you started to talk about this, Melissa, but service recovery. How do you go about, what strategies are in place to effectively work with patients who have had a negative experience or family members? Ron, I've heard you refer in the past to the art of an apology, and I know you have some really good strategies and tactics for how to deliver one effectively. But for all of you, how do you recover that experience when someone walks out the door unhappy?
I don't mean to keep going first here, but I think that there's a saying like, the best time to eat crow is when it's warm. So the best time to deal with an issue is like right when it happens, right? So the sooner you can get to the time that it happened, the more impact you're going to have in resolving it. So when I get a patient complaint, I don't put it on my to-do list. I will call the patient immediately. And, the Rate platform is helpful for that, because I get a low rating alert as soon as the survey is done. If there's a low score and they've shared their identity, then I can reach out to that person and I can call. And sometimes, just the timing. It's like, well, I just hit submit on the survey. Now you're already calling me back. This is like, it's almost like a wow in and of itself. And if you're able to resolve the issue quickly, that kind of carries it even further. And then I kind of go over the top, and I apologize because it's like, I will tell the patient, I'm going to come visit you at your next appointment. I put their appointment on my calendar, and I just walk down and greet them and make sure that everything goes smoothly. So it's a bit over the top, but I find that it works in terms of service recovery.
Yeah, and it's amazing to hear how personally involved you are, as opposed to just delegating this to a staff member who may have had that interaction with the patient or whatever else. And I'm sure that's an effective way of handling it.
And can I add one other piece? One other piece that I do is when I have an upset patient, I will call the patient, but I'll also call the primary care doctor, because we're a specialty practice. So when somebody's upset, they're going to call the doctor who sent them to us. So we want the doctor to know that if the patient's saying, hey, the doctor pulled out a knife on me, I want the referring physician to know that it was just a butter knife and not a scalpel.
Service recovery for the others?
I reach out to patients myself, and when I get the low rating alerts as well, and talk through the scenario. And I also give them my contact information, my direct phone number, put it on my calendar, so that you can greet them when they come and just let them know that you're engaged in making sure that everything is good with the next experience that they have with us.
Yeah, and I would say there's a couple more tricks that we've kind of employed over the years. And so I would say internally, from a culture perspective, every one of my practices knows that this is high priority. So they can interrupt me, they can get me on the phone. If my phone room or somebody picks up a call and the person's angry, I am available to do this and to help alleviate this problem. So culturally, everybody knows that I'm also part of the chain. I'm part of what we can do to resolve this issue as quickly as possible. The other thing that we found a lot of times is I go kind of one layer deeper and say, let's not wait for the bad review, right? Let's not wait to get a notification from Raterade or anybody. So culturally, one of the things that I shifted is this idea of you'll find people call in and they say, I'm very upset about something. And sometimes the nurse hasn't called me back. It's a result or something in your chain. We didn't get back to them. And there's this mistake that I've seen a lot of people make is to throw them back once again into the ringer, right? Just pass them back on to the nurses, pass them back on to something else. So we've kind of made two changes culturally, which is when somebody calls in and they say, hey, I'm upset, I'm really upset about something, we don't pass it back to the chain again. Like there's a point where you have to stop doing that to make sure this patient is taken care of. So one of the things that I've done in most of my practices, and it's not always easy because it's body counts, right? Is I've always taken my very best person. And I don't necessarily, a lot of people will say, hey, we're all patient advocates. Of course, we're all patient advocates. Of course, we should all be trained in the art of trying to do the best job we can. But I have always also taken my very best person, the person that I know is amazing at customer service, and said, when a patient calls in and says, I'm upset, and it's something didn't happen, that call immediately goes to my best customer service person immediately. And that it's the opportunity to resolve the issue in a way that has not yet obviously been resolved. And they're responsible. And I always made them responsible for, this is now on your plate. It's full accountability. And your job is to make sure that it is taken care of. Because too many times I found that some of the unhappiness came from multiple tries. And that was very disappointing to me, right? That this person, by the time I got him on the phone, is upset and yelling at me or upset with me and saying, this is my fourth call, my third call. And I was dumbfounded, right? Like, how are we here at a third call? I don't get it. But so it became an instructional thing for my entire staff, which is we don't do that. We don't keep putting them back over and over again and then giving them an assistance or a pressure valve to help alleviate that immediately per Ron's commentary. Don't let that thing sit and fester, man. Let's handle this somehow. Let's get it done.
I know we're saving time at the end for some questions, but I'm looking at the chat and Nikki from our audience asks, Brad, is your best customer service person compensated for that work? Which I would think rewards them, but also incentivizes others to kind of step their game up in the customer service category.
They are. I will tell you that it's a very tricky slope. I know that in the era of, we're supposed to pay everybody the same and all these tough guidelines that we're all dealing with, I will tell you, I'm not on that page. I pay people. I try my best to pay people who are superstars for being superstars. And I know that's not easy. I know that's a tough challenge, but myself, if I'm in control and I have control over this conversation, if I have a superstar that is better than everybody else, I will do something to try and compensate them for that level of service.
And jump in with one more piece of information about service recovery. I think sometimes the best thing to do in service recovery is to avoid the need to have a service recovery opportunity. So this is something that I've done in the past, and I would just challenge everybody to do the same. It's called blueprinting, and it's really just to look, it's kind of just take all the steps that a patient has to do to sit in front of one of your physicians. So if you're a physician and you think about, you could be the best physician in the world, but your patient has already called the office to schedule an appointment. How was that experience? They've interacted with your portal. How was that experience? They've got reminder calls from our practice about their appointment. They've driven here. How was the traffic? How was the parking when they checked in? How was how are the check-in people? How was that experience? And what does the whole place even just look like? Is it clean? Does it look dirty? So you could be the best physician in the world, but if all those fail points that are before the doctor even says hello, my name is, if you haven't done a good job to that point, then, it's really hard for the physician to recover the service from the initial interaction. So we want to empower the physician with having the patient sit down and just saying, wow, I can't believe somebody helped my wife out of the car and brought her in a wheelchair. I didn't expect that. Or everybody has been so nice, and I can't believe I'm seeing you so quickly after I checked in. Appointment waits can be an issue too. So all things to consider. I would recommend blueprinting for your particular practice.
Blueprinting, that's a great way of framing it. This reminds me, I once got myself into hot water because I was talking to a practice administrator in New York, and I was asking, how do you make room in your mind for what I referred to as the little things? Things like, does the parking lot look nice, and is the facility clean? And you're trying to deliver high quality care and save lives in some cases. Like, how do you devote attention and resources to those things? And he jumped all over me and said, there are no such things as little things if our patients care about them. So I hear you saying something very similar in blueprinting the entire patient experience so that at every step of the way, it's a good one. I have one more question about service recovery. It sounds like you guys all place enormous priority on this. You're personally involved. It's a high priority. My question is, why? Like, what is the value in this? It seems like it would be very tempting to say, well, 98% of our patients have a great experience, and this one is disgruntled, and we're just going to let it go and not worry too much about it. What's the value of recovering that one patient's experience? Is it your reputation? Is it retaining that individual patient? Is it your relationships with the referring physician? Why do you place such high value on this?
I'll let somebody else go first.
Yeah. I will tell you that. So, the worlds I come from almost always are private clinic with, kind of an eat what you kill experience, and, and you have the way to make money is patients, right? If we're not taking care of patients, you don't make money. So that's the primary factor. If you're not taking care of patients, you've already got a problem, especially in private clinic, where if you don't have patients, you don't make money. So in that process of a bunch of docs trying to pressure me for more and more patients and more, hey, we got to be kicking butt at all times. Doors have to be full. When I show up, I want my schedule full, all those things. I did a lot of research on, trying to understand the marketing of healthcare, the marketing of private clinics and all that. And everything that's ever been presented to me still says that word of mouth is still the most important thing we will ever do in terms of trying to get patients to come to your practice. And so that's always been the thing for me that sticks in the front of my head, is that we all know that to build your practice or increase patient volumes, you need people telling good stories. That's the best way to do it. And the counter, which everybody knows, is especially in the old days of, when online reviews started, as you were talking about, Mark, where certainly the 5 patients out of 1,000 that you did a poor job on, they are certainly going to go tell the world, right? Yeah. They are really upset. They're going to post online. So that's why, to me, it's irreplaceable in terms of even taking it to the concept of practice revenue. It's irreplaceable customer experience.
So that is a direct ROI correlation mediated through word of mouth and reputation, but fundamentally that's about protecting the bottom line.
Yeah, I mean, ultimately the patient experience is marketing, right? So when you put a billboard up or put an ad in a magazine, that to me is sales. Marketing is, to oversimplify it, finding what patients want and giving it to them. They want to have their need taken care of and their expectations surpassed. So the whole patient experience is your entire should be your entire marketing plan, or should be built from that entire experience.
Melissa, I see your head nodding. I assume you agree.
Yes, we all want to serve our communities well, and I think realize the value of the reviews and the input that we get from our patients. It's invaluable, not only to your bottom line, to your reputation, just to your community. So we all are in this because we're passionate about what we do and we want to do it well. And we want our physicians and our staff to have those same core values, honestly.
Yeah, so I guess this leads to another question. The first question was essentially, what's the cost of a dissatisfied patient? The flip side of that is, how do you showcase and extract value from all of your satisfied patients? What are you doing to put that into your marketing efforts or your sales efforts, as Ron described? Are you able to leverage great customer service and happy patients in the growth of your practices? And how?
I think we have gained significant value from the responses that we've received. Some of things are as simple as maybe your exam rooms are outdated and they would like to see something new and fresh. And we applied some murals to our walls and have everything from dinosaurs to sloths and safari scenes, and the children love it. The parents are happy because the kids are happy. There's other comments that we get from those that we can all gain value in, and also gain confidence that we are giving great service to our patients. And I think that's invaluable with staff, that they are hearing those good responses and seeing those as well. But the information that we get from those surveys, we read every one of them and we try to work through how we could incorporate better processes, upfits, whatever it takes to make sure that everyone is very comfortable coming into our facility.
Yeah, I would concur that, Raider 8 is in many ways a double-edged sword. It's giving me information about my practice that I can manage the patient experience and help me from an operations standpoint, make sure the patients are having a good experience. But then it's also kind of building the online reviews. So it's taking that positive feedback that our patients who are happy, who normally wouldn't post online because it's usually the unhappy person who thinks about doing it. It makes it easy for them to post online reviews. So for me, it's something I don't have to think about. It builds the online reviews. So when people are looking for services provided by my practice, they find us, they find good reviews. And that allows me to focus on the operational feedback that I get from the patients through Raider 8, and then I can address those accordingly.
So I'm just interpreting that a little bit as it's almost like the external facing online reviews are kind of the marketing side of patient feedback, whereas the internal commentary that you get for your own practice allows you to identify kind of areas of weakness or areas for improvement and address those. And did I hear that correctly?
Yeah, absolutely. We had a parking issue in one of our entrances to our practice. So we noticed immediately our scores were really low for that particular entrance. So we have made a change to how our staff parks to make more parking available to staff. And then we're able to look at that and see how the scores changed as a result of that. So there's a lot of objective data to support decisions and improvements. So we had a problem, we tried to fix it, and then this is what happened to the score. So kind of the cause and effect is very, very helpful.
Yeah, and I'd like to add to that to kind of correlate it to, back to this conversation a little bit about what's the measurement, right? What measurement do we have? And so, I like to approach it like Ron's talking about as kind of program management. It's a continuous evolution. It's a continuous process to try and fix everything that's not working well, but also to maintain it, because maintaining it is a totally different thing it is at the highest level you can maintain it. And what I found is in, two practices in very highly competitive markets that you can correlate this type of program management, meaning the consistent desire to improve both the internal issues within your practice to provide better customer service, and if your reputation on the outside starts to match those efforts and you start to see the outcomes for the work that you're doing, I have been able to effectively see also a rise in my referral base at the very same time, and patient base, especially if you're in specialty and you're constantly relying on other practices to refer to you in a highly competitive market. It's very difficult to stand out sometimes and to make sure that you are getting all the referrals you could possibly get within a market. And very, very clearly, you can see the correlation sometimes between our efforts on reputation management and patient satisfaction correlate to higher trending volumes and referral rates.
That's great to hear. Obviously, we've talked quite a few times about surveys and data and getting feedback consistently from patients. But more broadly, do you guys find that there are other technologies that you've put in place that are impacting positively or negatively customer service and the patient's experience through your journey? A lot changed during COVID in terms of like touchless, no contact and that kind of thing. And I think increasingly we all know patients are expecting to be able to do things online and seamlessly. So the question is, what other technologies have you brought to bear in this customer service category?
I can throw something out. So we have recently started using something called ePanic. So ePanic is, it goes onto the computer screen of the person who's doing the check-in or check-out. And if they're having an interaction with a patient that isn't going well, they can either hit a red button, which means, I need help immediately, or a yellow button, which means, it's a little bit less of a need. So there's, in terms of urgency, so a person without doing anything can just click on that, and then it goes out as a text and an email to the management team. So
that's for your staff to use.
For the front, yeah. So the front desk folks who are dealing with somebody who's unhappy can just hit a yellow button on the screen. They haven't said anything, and then I will, or somebody on the team will, we kind of rush there and then make it look like we just stumbled upon it. We get down there pretty quickly, but then we'll just kind of like, oh, hey, how's everything going? And then, then we can interact and try to help the person who's starting to feel like they're in a little bit over their head or needing some help with a patient that's kind of going the wrong way in terms of the experience.
That's great. You said earlier, the best thing to do is to prevent the need for service recovery. And I can see how that, this is like the silent alarm at a bank. That's great.
Yeah,
Brad
absolutely.
or Melissa, have you guys put other technologies in place that improve patient experience that are working well?
I have remote check-in that we implemented during the COVID pandemic, and that's working well for us. Patients utilize that probably about 95% of the time, which does reduce the workload for the front staff. So that's going well for us.
Yeah, and I would share, and I don't know if Ron's experienced this, as an example in the post-surgical space. It probably applies to a lot of other things. There are new tool sets out there that are really a combination of like patient-reported outcomes and customer service, right? So there are these apps that are available. So if a patient, for example, has a knee replacement or a hip surgery, a lot of the new science or whatever you want to call it will tell you that post-surgical, for example, patients who are quickly handled in terms of concerns report much higher and better outcomes than anybody who's not basically addressed. So what happens is if they're not effectively addressed, there's a lot more calls to the physicians. There's a lot more revisits back to the practice, or maybe even going back into the hospital, where sometimes a quick reaction can kind of settle that down much quicker. And so all of a sudden the patient-reported outcomes are much better. And it's a tool set. So what ends up happening is it's kind of a replacement of the old, hey, call in to a call service and wait for a doctor to respond. So it basically adds a much faster way for a doctor to communicate, or a nurse or an NP to communicate back and forth with a patient in any type of environment where the post-care is vital. And those tool sets, I've seen a lot of positive things come out of those tool sets. But one of the things I can tell you that was really obvious was the patient satisfaction levels went up post-surgery, as an example. And I've had physicians use them and physicians who don't want to use them. I'm kind of an advocate. I thought there were some pretty powerful tool sets out there that can help the post process, make the patient feel like they have access so that they can communicate with their physicians or their team.
Very interesting. I'm keeping an eye on the clock and trying to leave some time for audience members to ask questions. Now's the time, if you've been thinking of some questions, to add them to the chat, and Sandra and I will do our best to insert them. I'm looking at one that was from earlier in the discussion, again from Nikki, asking, I'm curious to know if there are customer service competency checklist or similar types of materials that you guys use in your practices and might be willing to share with the group, or at least talk about at a high level with the group. Any kind of, on paper, kind of here are the core competencies of what we're looking for?
We have a code of conduct. I refer to it as kind of our golden rule checklist. It's everything we should have learned at a very early age, how to treat others and what responses we'll get in return. We do give every new hire that code of conduct checklist, as well as review that in annual reviews as needed.
Mm-hmm.
In the past, I've recorded a PowerPoint presentation that kind of summarized some tools to use for customer satisfaction, along with an invitation to, if you're ever in a pinch, just call me, and I'll come down, that type of thing. So that was impactful. I think I did have some questions after. I think there was a competency afterwards, maybe like 10 questions, so that they could demonstrate having completed. I haven't done that recently, though. Maybe I should get back to that.
Mm-hmm. Yeah, we're in the process. The company I'm with right now, we're in the process of trying to build some of that, and specifically because of the clarity issue of clarifying what customer service looks like. And I just saw a question come up from Jessica that, so I've been asked this question a lot because a lot of times resources are a big deal for private practice, right? Especially if you're a small practice. And if you were at Disney, like Ron's talking about, there's world-class customer service training programs, and you're going to get all this stuff as you walk through the door. But a lot of managers simply don't have the time, the resources, or the money. And if you went to your physician and say, I want to take my 3 employees and send them to this amazing professional class, the docs are going to say, I don't know if we have the money for that. So what I would tell you is that there is now, with our new world, an amazing amount of stuff online, right? So what I would suggest to any manager who's really struggling or doesn't have a clear program, you can build your own program by doing just a little bit of work. So YouTube and all this crazy stuff has a lot of repositories. My favorite right now is LinkedIn. If you guys haven't got into the repositories on LinkedIn, LinkedIn's repositories are insane in terms of all of not only do they have videos, but they have entire training modules that piece together 9 videos, as an example. 9 hours worth of customer service training is the kind of thing that you can get. So you can find very high level customer service training available out there without having to, go pay a tremendous amount of money. And my suggestion would always be to spend a little time on it and learn yourself, like kind of what is everybody out there really defining as great customer service. And then you can easily revamp that into your own program. You can pick a course online, or you can pick 3 videos and really define it for yourself and your practice, what high level customer service looks like. And then do your own, put it out as Ron did, put it out as a PowerPoint and 3 videos that they need to watch. But there is definitely a lot of professional stuff available on customer service that you can translate into medical practices.
Yeah, and Brad, I will second your opinion of the LinkedIn resources. I actually didn't know those existed until a couple months ago, and we've recently started using them at Raider 8, and they've been wildly effective and popular. That's a great resource. Thanks for bringing it up. Other thoughts on kind of how to train the frontline resources effectively to deliver great customer service?
I have one thing that I think is really effective. If you can break people away from the front desk for a meeting or something, doing some role play, it's a little embarrassing at first, but it's really effective in showing somebody how to handle something. So, put yourself as the administrator in the hot seat and how you would handle the person and kind of demonstrate it for them. So it can be fun, and the role playing can really help. I think we all get good at handling things after we've done it a couple of times. So if it's the first time that we're dealing with somebody who is really angry irrationally, then it can be something that keeps you up for a couple of days. If you have the support, if you feel like this organization is behind you and you've dealt with this situation a couple of different times, even through role play, it can be empowering and make you better prepared to handle the situation.
Mark, I have a couple specific questions for Ron. Your silent alarm, is it a tool your IT folks came up with, or is it an add-on item that is available to others?
Yeah, I wish that we developed it. That would be great. But it's ePanic. I think if you Google it, if you Google it, there should be something that comes up. It's a subscription that I bought. It's a one-time fee actually. It was $500 and it covered about 20 different computers, and you can control if it's just text or emails. I find that texts were the most impactful way. So my cell phone would go off, as would 3 or 4 or 5 other cell phones would go off, and whoever was closest would get there first and help with the situation.
And for Melissa, is your remote check-in functionality part of your PM system, or is it a separate vendor?
No, it's an add-on through Phreesia.
All right. And another question, how are the experiences of those patients who don't have internet access captured?
Is that a question for me?
I guess the 3 panelists, I think they're wanting to know, do you send paper? What do you do if they don't have a portal?
Well, we generally don't ask. People don't necessarily know that we might have signage that says that they're going to get a survey from Raider 8, but we don't necessarily ask if they have internet access. So we just feel like we're getting so much feedback that if the person without the computer has a complaint, that we're probably going to hear that same experience from somebody else. Would be my response.
Yeah, and just speaking that because these folks all use Raider 8, speaking from a functionality standpoint, we request feedback from patients both by text and by email, which hopefully captures the vast majority of the patient population. Even if they don't have internet, they are likely to have a cell phone. And of course, we're simply not going to capture 100% of every patient's experiences and interactions, but to Ron's point, capturing enough or a majority gives you a pretty good sense of what's happening overall in your patient population.
Okay, I think we were able to get through the questions, and I think our time's up. I want to thank all of you for taking the time to join us today, and want to thank our friends with Raider 8 for this presentation. It's been fantastic, and the discussion was wonderful. I learned a lot. I've got take backs. It's great to hear from our friends from NCMGMA, Ron, Melissa, and Bradley. And once again, the session has been recorded, and you'll have the link shortly, and it's made available to you. So watch for your email, and everyone have a wonderful day. Stay safe and well. Bye.
Thanks, everybody.
Thank you, everyone.
Thank you.
Take care.
Guys.